Even if you or a loved one has a family history of breast cancer, odds are overwhelmingly in your favor that you do not carry the BRCA gene mutation, which causes breast and incurable ovarian cancer. But we've all heard so much about this gene. What if you are worried? Dr. Ebidaldo Silva, a professor of surgical oncology at UNMC, cited the example of Oscar-winning actress Angelina Jolie.
Her mother had ovarian cancer, and her aunt, her mother's sister, just died about the same time that Mrs. Jolie had her surgery of breast cancer. So in patients in whom that is an issue, then the first thing to do is to sit down and draw a picture of their family tree. And then as you look at generations in your family pedigree, the genetic counselor can calculate if the family pedigree significantly warrants that you have the BRCA gene testing.
Despite all the publicized cases, most women will find that they don't have as much need to worry as they had thought. But in the rare instances in which there is a BRCA gene mutation, it is serious.
The BRCA gene carrier also has a 20 to 40% chance of developing ovarian cancer, which is incurable. And there are no good tests to detect it early. None. By the time you find it on a test, it's too advanced. So what we recommend is that if you are a gene carrier, right, you have your children as soon as you can, and you can have your bilateral mastectomies, preventive or therapeutic, depending on if they had a cancer or not. And then after you have your children, you can then have your ovaries removed before they can become malignant. And that's a very important part of the treatment, okay?
Dr. Silva said Angelina Jolie is a good example of how to handle the diagnosis of a BRCA gene mutation. But most women do not have to worry about carrying the BRCA gene.
After all, the risk is only 5 in 100, right, that you carry the bad gene.